Hello everyone, my name is Rachel Shields and I will be presenting on tiered intervention for school-aged children with language disorders. So just to preface before I get started talking about my research is what is a language disorder? A language disorder is characterized by a difficulty with understanding and or using language. So this is pragmatics, semantics, and syntax. So pretty much all the domains of language. A child with language disorder does not have brain damage, hearing loss, or an intellectual disability. So these things do not play a factor in this child's ability to understand and use language. An overview of the article I chose to write about. This article reviews evidence-based interventions for school-aged children who do have language disorders. The focus of this research is that intervention dose and method should match the child's individual level of need. The authors of this article support what's called a tiered intervention model, which I'll get more into later on. So, who and what is the target of this research? School-aged children who have language disorders and require different levels and types of support. This is the target of this research. What is the target of this research? It is creating specialized intervention methods that better fit the individual needs of a child based on their level of need, and basically the goal is to reduce the amount of error and time unused during interventions. So the method of intervention used is called tiered intervention. So using a tiered intervention model means that support increases in intensity depending on the child's needs. So the goal of this is to really be inclusive and preventative almost, to hopefully keep a child who doesn't need to be in speech out of speech and keep children in the classroom learning with their peers as much as possible. So before I get into the tiers, here's something to consider. Dose is pretty much the main focus of this intervention. So dose is the amount and intensity of therapy that a child receives. So this is how often therapy occurs, how long the session lasts, consistent, how many teaching opportunities are provided during the session, and how consistently intervention takes place. So this is, does a child go to therapy 3 times a week for 30 minutes? How many opportunities are provided throughout that 30-minute session for them to target a specific aspect of speech? All these things come into play when it comes to this type of intervention. So dose is a crucial part of intervention planning and this tier-based approach. So starting with tier 1, this is the lowest level of support that we will see in this intervention. This includes classroom-based language support provided to all students, not just those with language disorders. So this looks like teachers being responsible for creating an environment that is language rich so that vocabulary, comprehension, and communication can thrive. It does, however, still include SLPs working closely with the teachers to provide them with methods that they can use and apply in their classroom. So it includes a lot of working closely one-on-one together, and everybody does have to be willing to cooperate and learn. The goal is to provide an early support and potentially prevent further intervention from being necessary. So some examples of this kind of intervention, this level, are shared book reading and storytelling with the whole entire class. This promotes vocabulary growth and language comprehension. Teaching narrative structure and sequencing in the classroom, and encouraging classroom open discussion and peer interaction. So the big thing about tier 1 is that all children are included, even those without language disorders, so those with typical developing language. The goal is that maybe those students can help those who do have language disorders and who might need a little bit more help than the average child. Next is Tier 2. This is kind of our middle level intervention, and it is designed for children with mild to moderate language difficulties who do require some support outside of the classroom, the normal classroom. Intervention can be administered by teachers, teacher assistants, or an SLP. So, Tier 2 is effective when teachers really collaborate and work in conjunction with speech language pathologists. So, this requires them to be trained by their school SLP on evidence based intervention. This is classified as targeted support, so it does take place in a small group setting inside of the classroom to focus on specific language skills. So this looks like taking a group in the classroom, maybe setting them aside at a small table and just targeting some of their weak points when it comes to language development. So some examples are targeting phonological awareness skills so that vocabulary is promoted. This could look like using flashcards with targeted, planned out vocabulary words, picture matching games, and practicing retelling and recalling stories. This focuses on all the domains of language, pragmatics, semantics, syntax, and just promotes healthy language development. So lastly, Tier 3 is your more intensive therapy. This takes place outside of the classroom and selects children with intellectual disability, not intellectual disabilities, takes children with language difficulties and puts them in intensive intervention for children with more severe and complex language disorders. So this is individualized in a very small setting therapy from a speech language pathologist, not a teacher or a teacher assistant. And again, it takes place outside of the classroom. So this focuses on specialized and individualized intervention that targets each child's specific and more severe needs. So some examples of what this could look like in a speech therapy room are structured narrative and discourse interventions, continuous progress monitoring, long-term goals, and highly individualized games and activities for each child. So some benefits of tier-leveled intervention is that it allows for collaboration using the microsystems and mesosystems of each child. So this means including the teachers, including the classmates, including the families even with their speech therapy. And so everybody's included, and it really promotes healthy language development and collaboration when you get everybody involved in this child's needs. It also provides early intervention and preventative action, as I mentioned earlier. Doing things in the classroom to promote language development will always help children with developmental language disorders. And also, this makes things more accessible for schools with limited resources. So, we find that training up teachers to promote language development keeps more children out of speech. So, this kind of stretches what we have to work with in a school system. It also allows children to practice communication with their peers. So, as we know when looking at a social interactions theory of language emergence, that children really need this peer interaction to promote healthy language development. So, this really follows the social interactionist theory. Research also shows positive language gains overall for children with language disorder and children with typically developing language. And lastly, another benefit is that it is just really specialized for each individual so that we can focus on what kind of dose that they need. So, some limitations is that truthfully, teachers cannot take the place of a speech language pathologist. Teachers are wonderful, but even after training, the services they can provide are not equivalent to a trained SLP who has gone to school specifically to work with children with developmental language disorders. So, another limitation is that progress may vary depending on each classroom and intervention intensity. So, there's only so many things that you can control in this intervention. It may also be difficult to sort out language disorder from a child with an intellectual disability or a learning disorder in the classroom. And lastly, another limitation is that teachers and assistants would all have to be on board. So everybody would be really willing to have to everybody would have to be really willing to work together and collaborate for this to work. So in conclusion, a tiered intervention system is the most effective way to organize language therapy services. Universal supports help all students, so this is level 1. Targeted small group interventions help children with moderate difficulties. This is level 2. And intensive individualized therapy is required for children with a severe language disorder, which is level 3. This is an inclusive method that has been proven through this research to promote language development. Um, Overall, speech language pathologists still play an important role at all 3 of these levels that we discussed. Tier 3 is an important part of the intervention process that only a speech language pathologist can provide. However, Tier 1 and Tier 2 are just as crucial in collaboration with teachers, parents, and children with typically developing language. Working with the ecological system of a child helps support the child with developing language disorders even after they leave the therapy classroom. Here are my resources, and thank you for coming to my discussion.